What is diabetic foot ulcer?
So an ulcer is basically a break in the normal skin. If you lose the skin and the tissue underlying the skin becomes exposed, that's called an ulcer. A diabetic ulcer is one that occurs, it's a common term used for an ulcer occurring in the foot of a diabetic patient. This ulcer occurs because of the combination of nerve damage, infection, and vascular supply that we spoke about. So, a diabetic ulcer tells you that wound healing is not occurring normally in that area if it persists, right? To solve that problem, we have to realize what all are the components affecting the healing and solve the obstacles to healing that the patient is facing. They can definitely be improved, these situations, and the patients can heal.
How does infection spread in diabetes?
So, infection and diabetes have a relationship because infections are more prone to become severe, and the response to infection, which is comes from the immune system in our bodies, that gets affected by diabetes. It's a combination both of diabetes affecting the normal environment in the body and the fact that infecting organisms like bacteria get a better growth response from the excess of sugar which is present during diabetes.
When is amputation necessary?
So amputation is the worst possible outcome for a diabetic foot, but sometimes there isn't an option, and that usually happens. As we say in the medical community, it's either the limb is dead, deadly, or a dead loss. Okay, so a dead limb usually cannot be preserved because that part of the body is dead, it will not survive, so it has to be removed to prevent it from affecting other areas. Now the limb can become deadly to you because it's badly infected and is causing spread of bacteria through the bloodstream. This is called sepsis, and this can definitely be life threatening, and in such a situation it may be necessary to cut off the limb to prevent the infection from spreading into the rest of the body. Last is, supposing the limb is dying because the blood supply is not there, you will have to lose that part to allow some other part to heal. So these are the situations in which amputation becomes necessary. But it's important to understand in many times there are alternatives, and you can definitely do both. Decrease the extent of amputation required. Why is this important? As long as your foot has a preserved heel, you can still walk on it. But the moment you lose that heel, then you have to cut below the knee to get an amputated limb which can fit a prosthesis or an artificial limb. So if we reduce the amount of amputation required, that helps. Many times you can prevent the amputation by allowing the wound to heal by improving the blood supply to the wound. And this procedure, which can be done through angioplasty, is very, very important in preventing amputation. And saving the limb requires us to improve the blood supply.
Can early treatment save the foot?
It's very important in the problem of diabetic foot to intervene as early as possible. What do I mean by that? Now, often patients come to us when they've already got gangrene of the foot. And at that situation, certain parts of the foot will be lost because dead tissue doesn't come back. However, if we have a program where diabetic patients regularly undergo a checkup to see if the blood supply is normal or not, if the foot care is normal or not, this involves many different specialists like say vascular specialists like me, or say people who specialize in taking care of foot problems, foot specialists. And if they get together and we screen the patient and pick up a problem before it actually has caused gangrene, and we treat the patient at that point, definitely it leads to better results. Because one, less injury happens, two, healing is better, and three, the infection doesn't spread to the rest of the body and cause a visit to the ICU and possibly life threatening situations.
What treatments are available today?
So, diabetic foot treatment is a complex entity involving many specialties. This could involve, say, neurologists for taking care of the neuropathy component. It could involve foot surgeons for taking care of the foot abnormalities which are causing more injuries, or taking care of wound dressings, or taking out the parts which have died and allowing the healthy tissue to form and heal. It can also involve vascular specialists to improve the blood supply to the foot. And all these people put together take care of the foot, and if done in the right way at the right time, this can definitely prevent the situation from exacerbating and causing a limb threatening or life threatening situation.
Is surgery always required?
No, surgery is not always required. If the patient is treated early, then surgery may not be necessary at all. If we restore the blood supply, if we prevent infection from spreading, then with prompt and early response to a situation, we can definitely prevent major surgery like amputations.